Administration of life-saving medications in the pre-hospital setting may be one of the most important things an EMT will do for their patient. It requires the ability to recognize life-threatening conditions, such as hypoglycemia or an asthma attack, knowledge of which medications are used to treat these conditions, and how those medications are administered. Some medications can be administered by the EMT, such as aspirin for chest pain and oral glucose for hypoglycemia, while other medications, such as nitroglycerin for chest pain, bronchodilators for difficulty breathing, and epinephrine for allergic reactions, must already be prescribed to the patient, and the EMT will only be assisting the patient with his or her own medications. Oral glucose is indicated for patients with a history of diabetes who present with an altered mental status but are not unconscious. Other signs of hypoglycemia include agitation and pale, sweaty skin. Glucose can reverse a diabetic patient's potentially life-threatening hypoglycemia or low blood sugar condition. Oral glucose usually comes in a tube resembling cake decorating gel that can be administered with the assistance of a tongue depressor and placed between the patient's cheek and gum or under the patient's tongue. These areas of the mouth are very vascular, and the medication can be absorbed into the bloodstream quickly. For glucose administration, complete the following steps. Take BSI precautions. Consult with the medical direction and/or review any standing medical orders or protocols regarding administration of oral glucose. Most EMTs are allowed to administer oral glucose even if the patient does not have a prescription for the medication. Check the 5 rights of drug administration: that the medication is right for this patient, meaning that you have selected the right drug out of your medical bag or drug box, that you have the right dose, that you are using the right route of administration, and that you are administering the medication at the right time, meaning for a patient who is exhibiting the signs and symptoms which indicate the need for the drug. Also confirm that the medication is not expired. Confirm the patient's ability to swallow and the presence of a gag reflex. The patient must still have the ability to swallow on their own, otherwise administration of anything by mouth could cause them to aspirate and die. Explain the procedure to the patient. Open the tube, keeping it clean. Apply the glucose by squeezing it onto the tongue depressor. Remove the oxygen mask if one is in place. Insert the tongue depressor with the prescribed amount of glucose on it into the patient's mouth between the cheek and gum or under the patient's tongue. Remove the tongue depressor and reapply the glucose to the tongue depressor and continue the administration until the glucose is gone from the tube. Document the administration of glucose and the patient's response to it. It is helpful to have a set of vital signs before and after administration of any medication. If the patient loses the ability to swallow or becomes unresponsive, immediately discontinue administration. Be prepared to suction. In some cases, the patient may have a personal blood glucose monitoring machine and will provide you a reading when you arrive. A value less than 80 in a patient with an altered mental status is considered symptomatic and indicates the need for prompt administration of glucose.